Hi, I'm Susan Moore for Spirit of Women, and we're meeting the doctors of Banner Health. And today, Dr. Dan Heaston is going to tell us what he does here, orthopedic surgeon,
Yes.
specializing in...
Shoulders and elbows.
Okay, now we already found out you can't fix these.
I cannot.
But tell me what your typical patient would come into you for.
So I see a wide variety of patients, anywhere from kids that have injuries playing sports to patients that need shoulder replacements. We do a lot of fracture work and injuries, and then I'm one of the team physicians at University of Northern Colorado, so we manage a lot of sports injuries as well.
Okay, so that's probably a full-time job right there.
Yes, it is.
Now, I notice you have tennis shoes on. You practice pretty much all over Northern Colorado. Where do you go?
Yep, we run from Fort Collins to Loveland to Greeley, and we practice in all the facilities there.
Okay. So if somebody had an injury, would they be referred to by another doctor, or can they just make an appointment and come and see you?
Both. So
Really?
a lot of it depends on insurance. Some insurances want to have a referral in from their primary care doctor. We see a lot of ER and trauma follow-ups,
I'll bet.
and then a lot of patients just hear about us from word of mouth and come in for evaluations.
Okay. So you work with people that are really playing pretty hard, but are there some things that we all can do to prevent getting injured?
Absolutely.
Such as?
I think the reason that we do the things we do is we want people to be able to play sports and do the things that they want to do. So saying, well, you shouldn't play football, or you shouldn't jump out of airplanes, or you shouldn't do crazy stuff is not really a good option. There are ways that you can kind of prepare your body to do those kind of things, and stretching out well ahead of time, working up, building up some endurance and strength before you get involved in heavier contact things could make a huge difference for the weekend warrior or someone that just says, hey, I'm going to go do this crazy thing.
Okay. So tell me some of the activities people are doing when they become injured and their shoulders need your attention.
So there's a lot of activities that can cause injury to the shoulder. We see a lot of bikers that fall over their handlebars or have an accident and either break their collarbone or have what's called a shoulder separation. A lot of times skiers or people that are playing sports with overhead activities will dislocate their shoulder or injure the ligaments that stabilize the joint. Older patients a lot of times can have a fall or an injury where they break the bones enough that they need a joint replacement procedure.
All right, I want to ask you about joint replacement procedures.
Yes.
And on the elbow, you said I told you my symptoms and you said stretching would help that, but you've actually had a patient that you replaced her elbows. What was that all about?
So elbow replacements are not as common as hip, knee, shoulder replacements are, but we still do them for either bad arthritis or for really bad fractures associated around the elbow. I did one a few months ago on an 80-year-old woman who fell off her horse barrel riding, and she needed a replacement, and her first question for me was, when can I get back on my horse, doc? And I saw her back 6 weeks after her replacement. She gave me a really big hug and said, I've been back on my horse and things are going well.
Oh, how wonderful. And she could hug well?
She could. She actually said, I'm 80 years old, I can kiss you if I want to, too, and she gave me a big kiss. So my wife asked what all the lipstick on my cheek was when I got home from work.
It's an 80-year-old barrel racer. Bless her heart. And what injuries should be seen sooner rather than later?
So a lot of times you'll just get a sprain or you just get some inflammation. Most of those typically settle down without surgery, but if there's significant weakness or significant pain associated with something, getting in earlier to check on it and just make sure that nothing's displaced or torn is probably a good idea.
Okay. You know, one time I came off my horse and broke my tib and my fib.
You did?
And had to walk home.
Oh.
And the next morning when I woke up, I couldn't step on my leg. And then after I went to work on one leg hopping, I finally went to the emergency room and had 2 broken bones.
Oh my goodness.
So that would be seen sooner because
I couldn't. Be on the sooner side, yes.
Yeah, that made me pretty immobile. And I'm still riding that horse, by the way.
Good for you. Good for you.
What other things would you like to tell us about what you do, Dan?
I think You know, my group is involved in a lot of sports medicine. There's a few of us that are involved as team physicians for the University of Northern Colorado, and it's a lot of fun to be active in the community, involved with those teams, and to help those athletes, you know, reach their potential. We cover everything from feet all the way up to, you know, shoulders and hands, and just having a great time doing it.
Good deal. It's got to feel good.
It is. Helping people get back to do things that they want to do is why we're here.
Well, I hope I don't see you in the too near future, but it's nice to know I can get a hold of you, and you're all over Northern Colorado and Loveland,
Absolutely.
Fort Collins, and Greeley,
And Greeley.
With Banner Health.
Yes.
Thank you.
Thank you.
was
Appreciate
nice.
it.
Thanks. I'm Susan Moore for Banner Health and Spirit of Women.